Thank you very much for inviting me to say a few words about the importance of decarbonising the healthcare sector, the NHS in Wales, and how by reducing carbon waste, we can help the healthcare system, but also the climate. And while we're about it, we can also improve health as well. So let me start with this summary slide, which shows us roughly where we are now with climate change. And what you can see in that upper blue line is where we're headed to. And that's a future in which temperatures are perhaps 2.7 degrees centigrade on a global average, higher than pre-industrial times. At the moment, we're about 1.1 degrees, slightly over that. And sadly, it looks very unlikely that we'll be able to keep within the Paris Agreement target of 1.5 degrees. Indeed, we're likely to see that exceeded in coming years. So it's really imperative that we accelerate rapid reductions in greenhouse gas emissions. And the green line shows you where we need to be going, which is about 7% reductions per annum, repeatedly on a global scale. And we're very, very far away from that. And most recent data showing that the carbon dioxide levels, and carbon dioxide is the biggest contributor to greenhouse gases, is at the highest level that we've seen it. So a very, very concerning situation. And you can see that there are various pledges and targets. It's not quite clear whether they'll be implemented. And although we can't reach 1.5 degrees, or probably can't reach it, we should still keep asking and demanding that policymakers attempt to do so. But we can keep to below 2 degrees if we accelerate ambition quickly. And we know that much of these emissions, of course, come from the use of energy in human society, over 70% of it, and then 20 to 25% from agriculture, food system, and land use. If healthcare was the healthcare sector was a country, it would be the 5th largest emitter on the planet, as we now know. And it's responsible for between 4 to 5% of global greenhouse gas emissions, something of that order. And on the right side of this slide, you can see where these come from. And as I think you'll be hearing later in the program as well, many of these come from scope 3 emissions. These are the indirect emissions, which are embodied in the devices, the medicines that we use, the transport system, food and catering, and so on. And smaller amounts come from the burning of fossil fuels on NHS premises. And then scope 2 is the electricity that the healthcare system buys in order to support its activities. So in order to reduce greenhouse gas emissions from the NHS, we'll need to tackle all these 3 scopes. And of course, scope 3 will mean working with other partners, including the pharmaceutical industry, the medical equipment industry, and procurement becomes an important driver of change. If we look at the Welsh situation, you can see that drugs and pharmaceuticals are responsible for about a quarter, something of that order. Staff commuting, perhaps over 10%. Medical equipment and supplies, about just over 10% as well. And then a whole range of other contributors as well. And you can see that it's about 1 million tons, something of that order, carbon dioxide equivalent annually. And when we say carbon dioxide equivalent, that's trying to also capture methane, which is an important greenhouse gas, as well as some others as well, such as those in anesthetic gases. So this gives you a greater breakdown. You can see that, as I've said, approaching 2/3 comes from procurement. And you can see where the others come from. These figures are a little bit out of date, probably haven't changed very much. And so it's going to be important to address all of these different sources in order to rapidly reduce greenhouse gas emissions. And as I've said, it means working with other partners in order to do so successfully. And it's quite clear that all domains of the NHS will need to be involved. Hospital services, primary care, continuing healthcare, nursing care, all professionals have a role to play. If we look at the ambition is, of course, to net zero by 2030, which will be difficult to achieve, but important to keep that ambition very, very high indeed. And you can see that if we just carried on with business as usual, we would expect an increase in greenhouse gas emissions. So it's really important that we reverse that trend very rapidly and dramatically indeed. And net zero is really a kind of theoretical linear decarbonization approach that does achieve zero carbon over coming years. As you can see, very, very ambitious, as I will reiterate, but important, I think, to retain that ambitious vision. What are the different options that we can take? Well, there are various options. I don't have time to go into all of them. One, of course, is increasing use of telehealth. And you can see from the slide the relationship between the distance traveled and the carbon saving. And you can see that this is taken from the US, where they have much longer travel distances, but also, I think, relevant for Wales as well. It's not always appropriate, of course, and there have been a number of concerns expressed about telehealth visits, as shown on the left side of this slide, taken from a US study. So it's not always appropriate, and one has to be careful about particularly those with sensory impairment or those cognitively impaired, for example. But telehealth can make a useful contribution in some circumstances in reducing the footprint of transport within the healthcare system. We also know, and I don't expect you to read the detail of this slide, but there's increasing evidence from life cycle analysis, LCA as it's called. This is a new database, a living database of healthcare environmental impact assessment, published in the Lancet Planetary Health a few months ago. And the nice example that I've ringed with these red rings is that of cataract surgery. At the top, you can see the greenhouse gas emissions from cataract surgery in India, the Aravind eye care system, which is a very famous system in India. And then at the bottom, or midway down, you can see the carbon footprint of cataract surgery in many middle and high-income countries, of course, including in the UK. And you can see that they're vastly greater than the Aravind Eye Care Centre, although they get extremely good outcomes. And that's because of differences in the use of disposables, for example. In some cases, pharmaceuticals perhaps, but most likely a lot of it is due to supply chain differences and the use of disposable, recyclable products or not, as the case may be. So increasingly, we're able to document the carbon emission from specific procedures, surgical procedures and others, and therefore to understand much better how to reduce the emissions using this technique of life cycle analysis. We're also seeing a wider range of toolkits available, and this is just the example of the RCGP's Green Impact for Health Toolkit, which has recently been revised and is very helpful in helping assisting general practitioners to improve their sustainability, reduce the risks of climate change, and reducing, in many cases, also practice expenses. And it gives very practical guidance of what you can do in your practice. So this is an important reminder that it's not just hospital services need to change, it's also primary care, indeed the relationships between primary care and hospital care. And then if we look more broadly, of course, you could argue that failure to prevent ill health is also a wasted opportunity and to some extent a waste of carbon, a waste of resources. And this is just the headlines from a paper that we published earlier this year, where we looked at the benefits to health and to the climate from achieving net zero emissions in England and Wales using the Committee on Climate Change projections. And we showed that through reduced ambient and household air pollution, through increasing uptake of healthy diets with more consumption of plant-based food, less consumption of red meat, processed meat, and so on, and more active travel, walking and cycling rather than dependence on the private car. This combination would give approximately 2 million extra years of life over coming decades if we could implement this kind of strategy at scale in England and Wales. So there could be big benefits to moving towards a much more health-promoting, health-sustaining economy within environmental boundaries. So in conclusion, let me leave you with the thought that reducing waste could be good for the healthcare system. There could be savings in resources, but there can also be benefits to our health and benefits to the climate. And recent research, example in this recent paper in Nature Climate Change, suggests that positive global and health or environmental framing can support, increase public support for climate policies. So, of course, we have to emphasize to people that we are on a very risky course for the future, but there is also hope, and that there are many policies, win-win policies, which can benefit our health and benefit the climate. And hopefully those policies can help to get greater support, public and political support, for the ambitious and urgent climate action that we need to see. Thank you very much indeed.
Unfortunately, Sandy Haines, who was one of our commissioners, was not able to join us. He's in WHO. But we have this rich expertise and insight from our commissioners. And one of the key things that the Commission has been keen to do is to look much more deeply at waste. And Sandy gave us a really good insight into that at the outset there. We're also rich in having insight from other commissioners, and suffice to say, we've used these great minds and insights to produce our recent document entitled What a Waste. And in that, we combine that thinking and we set out, if I can have the next slide, please, we set out a broad context for looking and trying to explore this in further detail. We came up with the following categories, if you like, having spoken and good information from others. So what we see here is workforce. We see huge amounts of waste in workforce, whether it's inappropriately not using our skills to best effect, whether it's using bank instead of core, whether it's not using the volunteer workforce and the wider workforce that we have. Administration, we know there's an awful lot that goes on in there, and certainly the US are looking very much at how they waste and what they waste in there. But again, services are really, really crucial. You know, whether this is food, cleaning equipment, you name it, there are real opportunities to reduce waste there. Treatments, we've heard an awful lot of doing only what's needed, no more, no less, and ensuring that what we do is appropriate and relevant to the individual. Energy, I know the Minister paid a huge bill on behalf of the NHS recently, an energy bill. I think we've got nearly 90,000, a million people employed in the NHS. If we perhaps shut all the lights off, or appropriate lights at night, or computers, we would save significant amounts in that. But certainly buildings, utilities, huge opportunities to do that. And really just S systems, trying to look at how we use technology and how we can use a whole range of other things. This was a broad framework from which we then hope to build. But the bottom line was, we can produce documents, as we know, we can produce elements of documents, but that doesn't necessarily change practice. So what we have chosen to do and what we want to do is to use the opportunity to raise everyone's awareness of their role in helping to reduce waste in health and care across Wales. And this, what we're trying to do is to galvanise that collective experience, that energy. This is everyone's responsibility, not just somebody up there somewhere in the ether. So we really want to bring together that collaborative, get organisations, people to sign up to this and to take responsibility. And I would encourage you all, if you've not already signed up to, please sign up to Let's Not Waste. We've got lots of organisations already signed up, but we want to see all of our health boards signed up, as well as individuals, and they will